Okay. So I'd like to start off by saying thank you guys for being patient with me as we got through the little kinks of the technology portions of it. So first off, I would like to start off by saying welcome everyone. Thank you for being here for my presentation. And I would like to introduce myself to tell you about my background. I'm currently a community health student. Did you record, Matt? Okay. And I came to Sun Life because I am finishing up a master's in public health program and community health leadership. And I currently go to the University of Phoenix, and I'm a candidate for the master's program in public health with a concentration in community health leadership. And I just want to say that I'm very passionate about health and wellness overall. That's what drew me to this field. And I'm currently going to be presenting my presentation, which is my capstone, my master's capstone. So let's dive into it. Okay, so shaping our future in our industry. My capstone is it's based off of pre-diabetic health interventions at Sun Life Health. So, fellow faculty and colleagues, I will present on my master's capstone, as I stated earlier. So at Sun Life, I'm going to be doing a presentation, and the part one I will be going over a background and need, and it consists of area of service for the health program. Part two is method section, project purpose, and target population. I will explain assessment, procedures, activities used during implementation. Then I will describe research strategies that will be used, and I will explain the data collected and trends demonstrated. So in sense of diabetic patients, so some trends may be medications where patients are on diabetes medication and there may be a trend in weight loss or their blood sugars may go lower due to the diabetes medication. And then there's going to be a discussion about blood pressure. Blood pressure in diabetic patients may range from high to low. It all varies from patient to patient. And then we have their A1C levels, which will show a correlation. And sometimes, most of the time, which within the data that I saw, there was most of their A1Cs was below 7.5. And lastly, I will describe my project outcomes and implications for practice. So moving on to the next slide, I'm going to be talking about part one, background and need, which is the origin and area of service of the health program. So speaking of Sun Life offers personalized services to improve clients' lifestyles and overall health. They focus on diabetes, nutrition, and social services, pharmacy, community health, dentistry, orthodontics, diabetes management, pediatrics, and much more. So they help individuals with chronic conditions like diabetes, heart disease, hypertension, liver disease, obesity, pediatrics, and several more others. So at Sun Life emphasizes one thing they're big on is integrity and employee involvement in patients' medical treatment plans. What Sun Life does is that they teach patients about nutrition and diabetes education through assessments and self-management practices. So moving forward, continuing on with this, within the background needs and assessment, so I want to say that Sun Life helps individuals with chronic diseases, as stated earlier, and they offer a quality of life of overall health. I want to say that their approach to health is within diabetes, and they teach diabetic patients about nutrition and diabetes classes 1 through 4, and they have integrated services such as pharmacy. They have clinical pharmacists that teach them all about classes 1 through 4, and we'll get into that later in a minute about what the classes are about. And they help them with diabetes management and much more. So moving on to slide 4, which is part 2, which is methods. The diabetes prevention program is implemented on weekdays and over the phone year-round. So it allows for more leisure time for diabetic assessments, diabetes education classes, and surveys. I, as a researcher, believe that to keep growing, surveys should be distributed throughout the pre-diabetic Sun Life community. The diabetic department has a health questionnaire that patients fill out, such as their past history, past health history, what chronic diseases they may be diagnosed with now, and also meal pattern eating habits, like such as what a pattern of what they eat for breakfast, lunch, dinner. They go through a questionnaire so they can assess each patient, and that's a pre-assessment, and then there's like a post-assessment. So they have diabetic materials that they have handouts that they give to patients. Follow-up appointments are available. So, and the handouts consist of the My Plate food method. So, what the clinical pharmacist is big on teaching the clients is about basically pairing a protein with a carb. So the protein helps sustain and keep the client full longer because it takes about 3 to 6 hours to break down protein. So once you pair a protein with a carb, it helps it helps starve off hunger more because you're full with the protein. So it helps to keep protein within the diet. So they teach clients about that too. And also they teach them about nutrition, chronic complications of diabetes, and so forth. So, in taking the first step to admit that one needs help to manage the health with diabetes is the first step. For instance, like my mom, I have a family member that has diabetes, and this information, in terms of doing this program, has been very helpful to them, and they have learned so much. They have learned a lot. And I just want to help the community as a whole because I have family members that have suffered from chronic diseases right now and in the past. So moving on to the next slide, we're going to talk about part 2, which is target purpose and population. So Sun Life Health is an Arizona clinic which conducts studies on diabetes prevalence, nutrition, social determinants of health, weight loss, chronic diabetes, obesity, hormonal dysfunction, and the clinic targets youth, adult, middle-aged to senior citizens, and I want to say 40 to 99. And my target population in my program and my capstone was, I want to say it was from 45, probably 40 to 65. So this involved clients. They involve clients within their treatments, and the study will involve fieldwork, practical experience in diabetes prevention and management, and community health student presentations. The target audience includes healthcare professionals, community health workers, which is also called public health educators, which I shadowed within the internship, and registered nurses, pharmacists, clinical pharmacists, diabetes educators, and caregivers, medical practitioners, and clinical pharmacists. So within the public health field. So within that, they aim to gain. I aim to get practical experience in diabetes prevention with shadowing these significant professionals within the field of public health. So the organization serves patients with various chronic illnesses, including heart disease, type 1 and type 2 diabetes, pre-diabetic, oncology, and general weight loss. So one thing I'd like to point out is my site supervisor, Dr. Matt. He oversees the organization and educational strategy, clinical pharmacy, diabetes, education departments, and community health worker program. So my study also allows the community health student, which is myself, to gain presentation experience in the healthcare field. Okay, so moving on to the next slide. So assessment procedures or activities used during implementation. The pre-assessment phase screens pre-diabetics, and educators as well. So they educate them on diabetes complications, diet medications, and consequences. The post-assessment includes patients involved to learn better lifestyle changes and may be prescribed medication. Some cultural barriers may be addressed through the plate food method, like we were talking about earlier, limiting non-starchy vegetables with carbs and protein. So, so it talks about the consequences of diabetes, and the post-assessment leads to lifestyle changes for the better. And I found a correlation between patients' BMIs falling between normal and overweight, but their A1Cs I found levels remained steady. So in terms of the post-assessment, it focuses on diabetes, healthy diet, medications, and consequences. I emphasize that diabetes can't be irreversible, but it can be managed with proper diet, exercise, and medication. And some things that may be limiting is clients trying to find that balance between what they already do and making that lifestyle change to make a healthier change for the better for themselves. Okay, moving on to the next slide. So this slide is more detailed and just talks about part 2, data collected and trends demonstrated. So I'm first going to talk about the slide itself, and then I'm going to go on to the notes. So a lot of the data that I looked at, many of the patients who are pre-diabetic, their A1Cs fell under 7.5, and a transformation resistance, in terms of transformation resistance by the patient, some patients are willing to change and others are not. So it's just finding that happy plan, to where the patients are willing to, like for instance, some patients drink regular soda. We recommend that they drink diet soda. Other patients are willing to make a change, and other patients are wanting to make like slight changes here and there. So blood pressure in terms of normal ranges, we want it to be less than 120 and less than 180. So the top number, we always want it to be less than like 120 or below. The bottom number less than 80 or at 80. And then in terms of Sun Life future, we hope to see an increase of the patients within 30% of patients, 30% more patients. At this time, I do feel more research is needed because I wanted to reach more community members overall. I just assessed 25 patients and I wanted to do more. So therefore, I feel like there's more research that is needed. So the community health student identifies serious health concerns within Pinal County due to obesity, weight management, diet, and lack of physical activity. They urge pre-diabetic patients to understand the value of cooking at home and make small changes. Sometimes you can use frozen produce, healthier cuts of meat, rather than dining out And also that big E word, exercise. Nobody likes to exercise nowadays, but sometimes it's good to include small activities like walking, hiking sometimes, or doing like yard work, or just doing small things to incorporate those things into one's lifestyle. It's hard nowadays with the technology world. Everybody's under tablets and computers and phones, but sometimes we need to get back to getting back to a healthier society again. So I would like to I would like pre-diabetic patients to understand the value of cooking at home and make even slight changes such as frozen produce, healthier cuts of meat, and then of course cooking from home. Okay, so embrace the change, lead the future. Part 3, results describe the project outcomes. Research strategies or approaches that were used. So some of the things that were used, so during the initial assessment process, pre-diabetics are first screened in the assessment phase, as I was discussing earlier. If they are at risk, they will be educated in 1 to 4 classes, including educational sessions on diabetes complications. So these were one of the classes that I was talking about. They will be educated. One is diabetes complications. The other one is diet and nutrition, talking about the My Plate Food method. So proteins, non-starchy carbs, your fruits and vegetables. I want to say sometimes they talk about insulin in these classes. They also talk about protein and other things. And then they talk about medications, how medications contributes to diabetes in terms of lowering sugars and weight loss, and then the consequences of diabetes. So after the post-assessment phase, they will be encouraged to learn better lifestyle changes if needed. They will be put on diabetes medication to aid in the prevention of diabetes. The community health student reviewed different pre-diabetic medical charts, and there was a trend in patients where they started their weight loss medication. They would start to see a drop in their sugars within their A1C, which would be evaluated every 3 months. I, as a community health worker, saw a correlation between patients' BMIs and it fell between normal overweight to obese, yet their A1C levels are at steady number. So what I saw within those charts is that their A1Cs was at a good range, under 7.5, but their BMIs was way up there, very up there, over 30.5 or 35, which is considered morbidly obese. So even though the patient's BMIs are considered in a remarkably high unhealthy range, they still had good A1Cs. But this typically goes down by the 3%, including weight loss. My goal for the post-assessment phase is that pre-diabetic patients get educated in 3 of the 1 to 4 classes and learn more about diabetes, a healthy diet, learning about the medications associated with the prevention of diabetes and the consequences of diabetes. The medication classes would also assist patients in controlling blood sugar, as mentioned earlier, and weight. So furthermore, the community health student wants the client to understand that once a person is diagnosed with diabetes, so it can't be irreversible. There's no going back once you have diabetes. Yet, patients can learn how to manage their diabetes, whether type 1 or type 2, with proper diet, exercise, and the assistance of diabetes medication. In addition to this, there are some clients who have cultural barriers, like as discussed earlier, so which may be Greek or Italian dishes. The clinical pharmacists make patients aware of the plate food method, which consists of them limiting and pairing the plate with a non-starchy vegetable, quartering the plate with carbs, 1/4 of the plate with protein, and most patients will make some type of change where they are eating more vegetables or pairing their carbs with the protein. The diabetes department teaches that their first bite should be protein paired with a carb to keep them fuller longer. We're almost done with this slide. After viewing the medical records and chart, I, as a community health worker, see that the study is needed because I saw several BMIs that were above the average BMI. And I saw that some patients fell into the dangerous range of morbid obesity. I want to say one thing. This is a serious health concern and an academic epidemic within Pinell County in terms of obesity and weight management and lack of physical activity within the city of Casa Grande. Because I just feel like when we'll find a fast food restaurant chains everywhere and processed foods that are easily accessible, a convenience store and grocery stores, even grocery stores. And I, as a community health student, want pre-diabetic patients to understand the value of, you know, buying frozen food, you know, cooking from home, eating more naturally. So incorporating traditional health principles into our lives is still essential, even if we live in a technological advanced society that is rapidly evolving. Moreover, research methods will be used in quantitative research strategies correlated with relationships. So vitals and diagnosis, blood sugars, and so forth. So, so basically, I want them to have improved and lifestyle, a better lifestyle. So I'm going to move on to the next slide. So, part 3, discussing implications for practice. I, as a researcher, want to witness a rise in healthier habits among patients and the adoption of new behaviors by my participants. Specifically, I want to see 25% increase in new behaviors linked to diabetes management, healthy eating, increased physical activity, and staying on track. 25% of pre-diabetic patients were evaluated by the researcher in order to determine their current level of diabetes prevention, where they fell into an obstacle related to it. Following data analysis, I, as the author, offer some life suggestions for better health and assisting these people for making better, healthier choices, healthier paths, helping them manage their prediabetes by eating healthy diets and exercising more. And this is my final slide of the presentation, and I have other slides following along with remarks. I'm almost done. Um, so I'm going to ask, where do we go from here? So this is going to talk about discussion and recommendations. We're going to define strategies to improve health outcomes. So looking at this picture right here, these are all contributed to diabetes. So diabetes can affect the heart, stroke, kidney, glaucoma, cataracts, the eyes. It can affect neuropathy. So when you look at this, it's a wake-up call to seeing what diabetes can really affect. And that's pre-diabetic patients know that they need to take their health seriously. And that, even though we have to admit that diabetes patients have a problem, they can always get help and resources to help manage their health. So the study recommends, so in terms of recommendations, the study recommends pre-diabetic patients to test their blood sugars, make necessary medication changes, schedule follow-up appointments, check their feet, brush their teeth twice a day, get blood work done every 3 months, get yearly dental exam. It also recommends flu shots, pneumonia shots, and hepatitis series. The goal is to help patients stay at their sugar glucose goals. And that's our goal. When we check their A1C, we want them to stay below 7.5, at 7.5 or below 7.5. And have a balanced diet, exercise, monitoring their sugar intake, Some patients may resist change, but others are happy to adjust. As I talked about, we want to we talk about getting more protein and we suggest things. They take it or leave it, but in all, some others are willing to accept a change and move forward to a healthier, better lifestyle. The intervention has improved patients' understanding of diabetes and lifestyle habits overall. So, in terms of remarks and thank yous, that's the end of my presentation. Um, and so we're getting towards the end of the presentation, and I want to mention some people that I would like to thank and those I'm grateful for meeting along the process of this project. I want to thank the clinical pharmacists, which is Caitlin and Angela. Thank you for helping me understand my project better and for your expertise and your input. I really appreciate it. I would like to thank Angela and Brenda for showing me the ropes and mentoring me throughout this process within my internship. This is a field that I have such passion about, and I really appreciate you guys showing me the ropes and I getting that face-to-face engagement with the clients for the first time ever. I really appreciate it. I would also like to thank um, Miss Miss Kamina for welcoming me on the first day, and other associates that I didn't mention, but you're not forgotten. But I want to mention you too. Um, and then I also like to thank one most importantly, Dr. Matt, for giving me the opportunity to get this fully on experience and finally get my foot into the door in public health and get that one-on-one experience with public health because I'm just I'm just so grateful that I had this experience and I'll never forget it. Thank you so much, everybody. Um, and then that wraps it up. And then I'm going to go into. So now we are at the end, and I would like to open it up for Q&A and feedback. And this is where you guys are supposed to give me feedback on my presentation because that's what my professor is required to have in my presentation.
Okay, audience, do you have any questions for Carol? I'll let you go first. Go ahead, Camille.
So in your presentation, one thing you mentioned, and I don't have diabetes or anything, and I'm not as well educated. So I do thank you for the presentation.
You're welcome.
One question I have is you mentioned that once you have diabetes, even if you no longer your scores are within range, that you always have diabetes. So even if you I know it's not cancer where it's in remission, but so are you saying that once you're diabetic, you're always going to be a diabetic, even if you're not taking diabetes medication?
Well, that's for pre-diabetics. What this presentation was about was for pre-diabetics preventing getting diabetes. So, for instance, I'll use myself as an example. I ended up eating when I was out of school. This was a few years ago. I ended up eating like a candy before my blood work the next day, and my doctor took my blood work, and then he said that I was pre-diabetic. And then years later, I took my blood work again, and I wasn't pre-diabetic anymore. So, in terms of that, once you have diabetes, you always have it, and it's non-reversible. They can manage it and learn how to. They have to add exercise and nutrition and watch their sugars and everything. Some people are not as bad where they have to take insulin. From my mom, for instance, she takes medication to control it, like metformin, but she doesn't have to take insulin to where it's severely bad. Some others, there's high levels of diabetes and everything like that. But pre-diabetics are more able to prevent it. basically. But once diabetes are diagnosed with it, like type 1 or type 2, yeah, there's always stuff with it, like a diagnosis of a psychological condition. So yeah,
Thank you.
you're welcome. If you have any other questions, please let me know.
Anybody else out in the internet land have questions for Carol? Oh, looks like Angela's got one. Angela.
Yes, yes, Angela.
Hello, can you hear me?
Yes.
Okay, so I do have a question. You briefly mentioned social determinants of health. Would you be able to give me an example of a social determinant that could be hindering patients here in Casa Grande's health in terms of their nutrition? And how does Sun Life help to minimize that social determinant?
So an example of that I wrote in my paper is that a patient, when I observed a patient in a clinical pharmacist's office, one of them was transportation. So the patient had housing, but they had trouble with transportation. And I know I didn't discuss on social determinants of health a lot, but they had a walker, and they were needing transportation, and so transportation was kind of hard to come by because they would either not show up or be canceled. And so they would get Lyft or Uber as their insurance would pay for it to have them ride to take them to their appointments. And so basically when she put her scooter in, they were complaining that they can't have a scooter in their car. So she was complaining about that. So she mentioned that to the clinical pharmacist. And so the pharmacist mentioned that, that's the transportation that they have at this point, but they can do their best to make other recommendations for transportation for other drivers to come and get her, to take her to appointments that would accommodate her, like such as a car that's for wheelchair bound people, to be able to accommodate her with her walker, because transportation may be a big thing for clients in Casa Grande. And that's what the solution was to accommodate her with her walker, I want to say. And then I'm trying to think if I mentioned anything other of social determinants of health. Also, I want to say teaching them, healthier habits. I did talk about that in a presentation, but having them have good insurance plans and connecting them to good insurances. And sometimes people don't know what insurance benefits that they have. So making them aware of that by educating them on their insurance benefits and stuff like that. Like flex cards or things that pay for over-the-counter things that their insurance would pay for.
Thank you. Good answer.
You're welcome.
Matt's got a question.
Yes, Matt, what's your question?
What did you learn, because it's about public health,
Yeah.
what did you learn about the culture of people that we serve at Sun Life, and how would you personally tailor any of your advice to our specific population that we serve?
Okay, what did I learn about the culture of Sun Life, and how would I?
The population of patients, not
Okay.
just Sun Life's culture, but the patients. What did you learn about the culture of patients that we serve, and how would you tailor your advice differently to that culture?
Okay. So in terms of the patients, I learned there's a lot of diverse patients within Sun Life. And I realized that a lot of the patients are either bilingual or only speaking one language, which is Spanish, or only English. And I learned that a lot of the patients maybe have an economic background that's challenging. So I learned about that, and there's other scenarios where patients, let me ponder on that for a second. There's other scenarios where patients need to bring their loved ones in because they either had like a chronic disease happen and where they need to be there to support them, or have supports, or where all their supports are not in place, like such as social determinants of health, like what we talked about. They still need the necessities, for their health needs to be met. So that's one thing that I learned. And remind me of your second question, follow-up question.
I think it was, how does that change the way that you educate the patients?
How does that change the way I educate the patients? I want to say that getting into this field, it changes it by letting them know what resources are out there. So making them aware of the resources that are out there for them in terms of their insurance. And I'm sure there's other resources too as well.
But on top of insurance, it's also culturally competent healthcare, which is important that we give our patients that require different, different styles of eating, different resources, making sure that a lot of these resources are also Spanish speaking and can support the population that we support.
So like having an interpreter.
It's part of it.
Yeah.
But also dietary influence and what this patient population eats versus other patient populations. You've always got to keep that in mind as you're doing pieces of that education too.
Yeah, so probably having on assessments, having on the assessment any dietary instructions, any dietary allergies that they have, cultural preferences in terms of food. That's a good one. You made me understand a little better.
Perfect.
Also, sometimes it may be certain providers that they want to see, whether they speak the same language as that same provider, or maybe a cultural thing where they want to see a provider of their own background. I think you know where I'm trying to get with that. So that's a cultural barrier of that practice. Does anybody have any feedback for me about the presentation?
I think for me, it's good that you got to do this and learn and see what an integrated health system looks like, because it's vastly different than other healthcare organizations that are out there. So it's good that you were able to see that integrated healthcare.
Yeah, me too. Do you have any feedback, Miss McCamina? Okay.
Does anybody else out there in internet land have feedback? I think part of the feedback could have been when you are presenting statistics and stuff like that, make sure you're clear about what you want to present. Some of the tables could have been a little bit more clear throughout the process. There was one that said like A1C at the top, but some of the metrics were actually referring to blood pressure. So just make sure that you spell those things out clearly when you present in the future.
Okay, thank you.
And then also, if you've ran any statistical analyses or anything like that, just make that clear in the presentation as well.
Okay,
I guess I would just say, just knowing how to maneuver with your, like how Matt had to get in for you to get you set up. Just have everything prepared, already set up and everything to make it easier for you. That way you can start on time.
okay,
That's true. Probably should have done a dry run beforehand, or at least made sure all the technology worked beforehand. That's good feedback.
okay. Oh, Angela has a question. Yes, Angela?
I guess my feedback to you would be like for any future presentations to like really write down what you want the audience to really take away from the presentation and what you truly want them to understand. And even writing some like goals that you really want to mention and just planning out each section without like having to say something twice or three times.
Okay, got it.
That was really good.
Yeah, it was
Yeah,
good
that is
feedback.
good. And then in a presentation like this, where we're teaching about a specific population or a subgroup of people, you refer to our patients as both patients and clients. And I would kind of pick one, whether you want to call them patients or whether you want to call them clients. I prefer patients myself because that's what they are. They're patients of our health center. But just pick one and stick with it because I heard you kind of use those two interchangeably.
Okay, got it.
So how do you feel about your presentation? How do you feel that you did? Or is there anything that you think you could have done differently?
I mean, I agree with all your feedback. I agree with Angela that maybe some things were repeated twice. I have to say I was a little anxious in the beginning, but as I eased on into the presentation, it's kind of like an interview. I get a little nervous during the interview, but then once I ease on into it, I find a flow and I go with it. So um yeah, I know I've been told to speak clearly and I practice it at home and I practice a presentation at home and I've presented in college several times before and I kind of look at it like this, but it's different because it's like a career school. So I think I did fairly well. Just some things that were constructive criticism, and I'll know to know for future presentations. So thank you guys, everybody, for listening to the presentation. I truly appreciate it. I've gained so much from being here, and I thank you so much for this opportunity. Until we meet again.
You're welcome.
Thank you. Is that